When it comes to facial beauty, lips are one of the most expressive and emotionally charged features we have. They shape the way we speak, smile, flirt, and communicate, often without saying a word. Fuller lips can instantly make a face appear softer, younger, and more alluring. But modern lip enhancement isn't just about making them bigger, it's about creating harmony, balance, and a natural texture that fits your features. In this video, we'll explore every kind of lip enhancement available today, from non-surgical in-office treatments to surgical lip lifts, semi-permanent lip tattoos, and even simple at-home tricks that give the illusion of volume. You'll also get real numbers, real results, and the honest truth. How long each option lasts, what it costs, and the hidden risks most people never mention. Non-surgical lip enhancements. These are the most common options in aesthetic medicine today. They require no cutting, no general anesthesia, and very minimal downtime. The results are instant or develop gradually, depending on what you choose. 1. Hyaluronic acid/HA fillers. Imagine sitting in a treatment chair. No anesthesia, just a little numbing cream and a mirror in your hand. Your injector studies your face, not just your lips. The balance between your nose, your chin, the way you smile. Because that's what good lip work is now. It's about harmony, not just size. And then, the first tool of modern lip artistry comes into play: hyaluronic acid fillers. These are the classics Juvederm, Restylane, RHA, Versa, Teosyl, all cousins of the same molecule your own skin naturally produces. Hyaluronic acid can hold up to 1,000 times its weight in water, which is why when it's placed just under the surface of the lips, they instantly look plumper, dewier, more hydrated, almost like they've been kissed by light. The technique is everything. A skilled injector doesn't just add filler, they sculpt. They can sharpen a cupid's bow, smooth out asymmetry, rebuild lost volume from aging, or even create a delicate lip flip by subtly lifting the edges. The result can be transformative, or barely noticeable, depending on your goal. Fillers last around 6 to 12 months, depending on your metabolism and the product used. Prices range from $600 to $1,200 per syringe, and sometimes you'll need two for complete balance between the upper and lower lip. Of course, there's always a flip side. The most common side effects, swelling and bruising, usually fade in a few days. But there's also a rare, serious risk called vascular occlusion when filler accidentally blocks a blood vessel. That's why you never go to a random med spa. You go to someone trained to handle emergencies with hyaluronidase, the enzyme that dissolves HA instantly. The good news? It's completely reversible, which makes it one of the safest, most popular cosmetic tweaks in the world. 2. Renuva, the injectable fat matrix. But maybe you're the kind of person who says, I don't want anything synthetic. I want something that feels like me. That's where the newer generation of injectables enters the picture. Meet Renuva. Renuva is fascinating because it's not technically a filler at all. It's what's called an injectable fat matrix, a tiny scaffold made from donor tissue, completely purified and cell-free, that tells your own body to grow new fat in that area. Think of it like planting a seed and watching it fill in naturally over the next few months. It's injected the same way as filler, but instead of giving instant results, it gradually builds your own soft, natural tissue. Volume that looks and moves like real lips because it is real tissue. One of the biggest benefits of Renuva is its longevity. It can last up to 10 years or more because the newly generated fat becomes a natural part of you. For patients who don't want to keep coming back for filler top-ups every year, this is one of the best long-term options available. Renuva is typically packaged in 1.5 cc per vial, so providers may charge a slightly different rate depending on how the product is sold. The average price ranges from $1,200 to $1,500 per EC, and the total cost for a full course of treatment often falls between $2,000 and $3,000, $5,000, depending on how much volume is needed. The only catch? It's still relatively new, not available everywhere yet, and requires an experienced injector who understands how to balance long-term regeneration with precision placement. 3. Botox lip flip. Now, for the minimalist who says, I don't want volume, I just want my lips to look a little more lifted, a little more present, there's the Botox lip flip. It's one of those tiny, clever procedures that change the game. Here's how it works. Instead of adding filler, a few droplets of Botox or Dysport or Xeomin are injected into the muscles around the upper lip, specifically the orbicularis oris. This relaxes the muscle just enough to allow the lip to roll outward, revealing more of its pink surface without actually adding volume. It's a whisper of change, like your upper lip just learned how to flirt again. The lip flip lasts about 2 to 3 months, costs $100 to $300, and has minimal downtime. Maybe a day of mild stiffness or tingling when you smile. It's often done alone for people who want a low commitment tweak, or combined with filler for a more sculpted but still natural look. There's no swelling, no downtime, and when it fades, your lips simply go back to normal. 4. Lip threads. And then there's something a bit more mechanical. Lip threads. If you've heard of PDO or PLLA threads for jawlines or brows, the same concept applies here. Tiny dissolvable sutures are placed just under the skin to stimulate collagen and slightly lift the corners or border of the lips. They won't make your lips dramatically fuller, but they can redefine the shape, restore firmness, or create that subtle upturned corner that makes a smile look youthful again. They dissolve within 6 to 8 months, but the collagen they trigger can keep the result lasting a bit longer. Prices typically range from $300 to $1,200 depending on how many threads are used. The main risks: small bruises, bumps, or unevenness if the placement isn't precise. It's an art, and like all art, it depends on the artist. 5. PRP or PRF, platelet-rich plasma/fibrin. Finally, for those who prefer a 100% natural route, there's a fascinating technique using your own blood: PRP or PRF lip enhancement. You've probably heard of vampire facials, and this is their gentler, more precise cousin. A small vial of your blood is drawn, spun in a centrifuge, and separated into its most regenerative parts: platelets, growth factors, stem cells. That golden serum, your PRP, is then injected into the lips to stimulate collagen and improve texture, hydration, and even the fine lines that form around the mouth. PRF, platelet-rich fibrin, is the upgraded version. It has a thicker consistency and contains a fibrin matrix that allows those growth factors to release slowly over time, creating a smoother, more gradual improvement in volume. Some injectors even create PRFEZ gel, which has a gel-like texture for a plumper, softer look. All from your own blood, no foreign material. Results are subtle and develop over weeks, lasting 1 to 2 years depending on your body. Treatment costs vary, usually $500 to $1,200. And since it's natural, you can repeat it safely to build more volume over time. Most people love it for its texture, not artificially plump, but healthy, alive, and softly defined. Surgical lip enhancements, the art of permanent balance. Sometimes subtle tweaks just aren't enough. For those who want a change that feels structural, something that doesn't fade in 6 months or depend on touch-ups, surgery becomes part of the conversation. This isn't about exaggeration, it's about architecture. While injectables sculpt and polish, surgery rewrites the framework. Imagine standing in front of a mirror, lifting your upper lip ever so slightly with your finger. That little lift, showing just a touch more of your teeth, making the lips look livelier, younger, that's exactly what a lip lift achieves. 1. The upper lip lift. Over time, the space between our nose and upper lip, the philtrum, lengthens. It's one of those quiet signs of aging people don't notice until they see a before and after photo. The upper lip starts to drop, covering the teeth and flattening the smile. A skilled surgeon can restore that youthful proportion by removing a tiny strip of skin beneath the nose. It's delicate, a matter of millimeters, but the change is transformative. The upper lip rolls outward, the pink part shows more, and suddenly the mouth feels expressive again. It's a favorite among those who want that lifted, elegant look without fillers. The healing takes about a week, the redness fades over a few more, and results are long-lasting. Typical cost: $3,500 to $6,000. The only trade-off? A fine scar hidden under the nose. Invisible when done by an experienced hand, but unforgiving if not. That's the paradox of surgical beauty. The closer it gets to natural, the more precision it demands. 2. The corner lip lift. Then there's the corner lip lift, a small but powerful gesture for faces that tend to look sad or tired at rest. Two tiny triangles of skin are removed near the corners of the mouth, turning them upward ever so slightly. The difference is often just a few millimeters, yet it can change a person's entire resting expression and from downturned to softly uplifted. But this one carries a little more risk. The skin here moves constantly and scars can be more visible. Many people today choose to mimic this effect instead with a Botox lip flip or subtle filler to nudge the corners up, avoiding the permanence of surgery. Still, for the right candidate and the right surgeon, it's a quiet transformation that brightens the whole face. Typical cost: $2,000 to $4,000. Fat grafting, your own tissue reimagined. Among all surgical options, fat grafting feels the most poetic because you're not adding anything foreign. You're borrowing from yourself. A small amount of fat is gently taken from another area, the abdomen, thighs, or flanks, then purified and injected into the lips. It's the ultimate organic filler. Your own living tissue takes root, forming volume that moves and feels exactly like natural lip tissue. But there's a catch. About 30 to 50% of that fat is reabsorbed during healing, so a touch-up may be needed. When it works, though, it can last for years, even permanently. Soft, subtle, real. Average cost ranges from $4,000 to $8,000, depending on whether it's combined with other procedures like a facelift or blepharoplasty. Downtime includes swelling and bruising for 1 to 2 weeks, and risks are mostly related to uneven fat survival or small lumps that usually smooth out with time. Compared to fillers, fat grafting is a commitment, but it's also freedom. No refills, no dissolving, just your body, refreshed. What about dermal or fascia grafts? In the early 2000s, surgeons sometimes used donor dermal tissue such as alloderm, or even a patient's own fascia, a sheet-like connective tissue, as a lip implant. These methods promised long-term volume, but they were firmer and often didn't move as naturally as fat. That's why most modern surgeons prefer fat transfer today. It's softer, safer, and completely biocompatible. No donor tissue, no risk of rejection. So while dermal grafts still exist, they've quietly faded into history. A reminder of how far aesthetic medicine has evolved toward authenticity. Semi-permanent lip enhancement, lip blushing. Now let's shift from scalpels to pigment. You wake up, brush your teeth, glance in the mirror, and your lips already look perfectly tinted, healthy, and defined. That's the beauty of lip blushing, a semi-permanent tattoo that gently enhances your natural lip color and border. Unlike the harsh lip tattoos of the past, modern lip blushing uses a soft, watercolor-like shading technique. A skilled artist can subtly reshape the border, correct asymmetry, and even extend the pigment slightly beyond the natural line to give the illusion of fuller lips, without changing the actual structure. It's not about enlargement, it's about luminosity. When healed, the lips look more youthful, more hydrated, and, most importantly, more alive. The healing takes about a week, during which the color looks deep before softening into a natural tint. Results typically last 2 to 3 years, and pricing ranges from $400 to $1,000 depending on the artist and pigment technique. Some people combine lip blushing with filler. The pigment refines shape and brightness, while the filler adds structure, creating one of the most natural, photo-ready results in modern beauty. At-home lip enhancement. Everyday rituals that work. Not every transformation happens under bright clinic lights. Some of the most effective lip-enhancing habits happen quietly, at home, in front of a mirror, or before bed. Let's start with the easiest fix: lip-plumping glosses and balms. Those tingling formulas filled with menthol, ginger, or capsicum aren't just marketing. They work by increasing blood flow to the lips, giving a rosy flush and mild swelling that lasts for an hour or two. Newer versions even include peptides to build collagen over time. They're inexpensive, around $20 to $50, and perfect before a night out. Just remember that tingle is a sign of stimulation, not pain. Next, lip masks and exfoliation. Dry, flaky lips reflect less light and appear thinner. A gentle sugar scrub or enzymatic exfoliator, followed by a thick balm, can instantly smooth the surface. Think of it as skincare for your lips. Hydrated lips catch the light, hold pigment better, and look naturally fuller without a single injection. There are also suction-based lip tools, the little vacuum cups that promise instant plumpness. They work, but only temporarily. The volume comes from increased blood flow and mild swelling, which fades within an hour. The key here is moderation. Overuse can bruise or break capillaries, so use them sparingly, as a styling trick, not a daily ritual. And finally, the oldest illusion in the book: makeup magic. A slightly overlined lip with a nude or contour pencil paired with a lighter gloss in the center can create believable depth and volume. Matte textures flatten the lips, glossy or satin finishes reflect light and make them look plumper. It's artistry that's been around for decades, proof that sometimes confidence is just a few brushstrokes away. Lip health and maintenance, the foundation of every beautiful mouth. No matter how advanced the treatment, healthy lips always start with care. Drink enough water, as dehydration makes lips flatten and pale. Use SPF balm daily. UV light breaks down collagen faster than anything else. Avoid smoking. It accelerates fine lines and shrinks blood flow. And nourish your lips every night with balms rich in ceramides, shea butter, or lanolin. Even if you never do a single procedure, these simple habits keep your natural lips soft, full, and radiant for years. There's no universal formula for the perfect lips. For one person, it's just a gloss and good lighting. For another, it's a careful dance of filler, pigment, and proportion. And for some, it's a surgical refinement that restores youth and confidence in one stroke. What makes today's beauty landscape so powerful isn't the number of techniques. It's the freedom to choose. To start small, to experiment, to change your mind, and to understand the science behind what you're doing. Because real beauty doesn't live in the size of your lips. It lives in how you feel when you smile. If you found this video helpful, don't forget to like, subscribe, and comment which treatment you're most curious about.